42 now. The kids are back in school, families are busy, but you don't want to let good health get off schedule. This is the host of TV's The Doctors, Dr. Travis Stork, and he's here with some tips for parents. Good to see you, Travis. Thanks for coming in this morning.
I appreciate you having me.
No problem. You know, I was just talking to my second grader about how important it is for him to be washing his hands all the time at school. They're out of our sight. Our kids are out of our sight when they're at school. So what are some ways that parents can make sure they're taking good care of themselves?
Well, I think the biggest thing with kids is creating healthy routines. If you create healthy routines at home, it will carry over when they get to school. And you bring up a simple concept that's huge for kids and parents alike: washing hands. If you don't teach your kids how to wash their hands at home, which in an ideal world would be 20 seconds with good old-fashioned soap and water, they're not going to do that at school. That's the #1 way, of course, that kids get sick when they're at school. So I really say that you need to be proactive with your kids' health, particularly now. It's the time of year where you're not going to see them for most of the day, and you hope that those lessons carry over when they get to school.
And I know that the folks with Crest brought you to town, and oral health is real important. You know, it's funny, my husband and I, we grew up with different habits as far as brushing our teeth and things like that, but I think our kids are going to have better habits than we did.
Well, and they should, because one of the things most people don't realize is that oral disease is tied to overall health. And the earlier you can get your kids into a nice oral care routine, the less likely they're going to develop things like gum disease, cavities. And now that we're seeing this is tied to other problems with our health, I'm really trying to be proactive and teaching parents, look, you need to, again, get into these routines with your kids sooner rather than later. And even now, the ADA came out and said, okay, as soon as your child's first tooth comes in, start using a little smear of fluoride toothpaste. And when we were growing up, that was not the recommendation.
That didn't happen at all, yeah. This enterovirus that's going around, that's got to be a big headline for your show. How concerned are you about that virus, and how concerned should we be as parents?
I think whenever a new infection comes around, this isn't new, but it's typically very rare.
It's more rampant this year.
It's more rampant, and also what I tell parents, and this is getting to the proactive part about putting them back in school, is if you have a child who has underlying disease like asthma, be extra careful. Make sure the school nurses are extra careful, because this enterovirus is really impacting kids with underlying asthma. Those are the ones that oftentimes are ending up in ICUs, in some cases on breathing machines. So again, it gets back to simple measures. Luckily, the same measures that can help prevent the common cold can also help prevent transmission of the enterovirus.
I want to talk to you a little bit about the show before I let you get out of here. You got your start in TV on The Bachelor, but really the medical part of TV on Dr. Phil, being a consultant on Dr. Phil. Do you think people are really into these doctor shows because we're afraid to talk to our own doctors? Do you attribute any of the popularity to that?
I hope not, but I will say that we all know doctor's time, when you go into the office, it's very limited. And what I hope is that it means folks are more and more interested in their health. And typically you hear about health and healthcare and people frown. What our
You guys make it entertaining, though.
We're trying to make health fun. I tell people all the time, if you can make health your hobby, and we try to make health fun on our show and make doctors less intimidating, if health becomes your hobby and then you pass it along to your spouse or a neighbor, we can really make health something that in this country we no longer frown at.
What's the most fun or maybe strangest thing you've had to do on the show? I was watching one day and you had some implants back here on your back. They were fake. You were trying to fake them into thinking that you had implants there on the back.
That was probably...
Is that one of the...
That was the 1000th show episode where we did a complete fake procedure where I went into to have surgery on butt implants, or with butt implants. So they did not look good, by the way.
No, you look fine just the way you are, Dr. Stork. Thanks so much for your time.
Thank you for having me.
Congratulations on all your success.
I appreciate it.
We'll be right back.